Welcome to this special edition of City Inside Out. I'm your host, Brian Callanan. News of the coronavirus crisis provides daily statistics on new cases or deaths. But there's another side to this crisis that is more difficult to see, dealing with behavioral and mental health issues. Now, we have seen in studies that nearly half of American adults are saying the pandemic is having a negative impact on their mental health. Calls from our state to the Federal Disaster Distress Helpline for crisis counseling have been coming in at a rate 7 times higher than usual. Locally, the Seattle Police Department reports a 21% increase in domestic violence calls compared to last year at this time. So, what mental health symptoms should you be looking out for in yourself or in your friends and family now and over the next several months? And how can people overcome the challenges involved in accessing help in a time of physical distancing and self-imposed isolation? To get some answers, we have a panel that includes Dr. Keri Mauseth. She is a clinical psychologist who sees patients. She teaches at Seattle U and is also the co-lead for the Behavioral Health Strike Team for our state's Department of Health. We also have with us Brad Forbes. He is Director of Advocacy and Public Policy for NAMI Washington, the National Alliance on Mental Illness. And we have Keri Waterland. She is Director of the Division of Behavioral Health and Recovery for the Washington State Healthcare Authority. Great to have all of you with us. And Keri, let me start with you here. I talked about a growing number of people calling into helplines for counseling during this crisis. That trend might be surprising to some people, but I think that really speaks to the need to end the stigma around looking for help when it comes to behavioral health issues, when it comes to mental health issues. I want to break that down. We're very much in a new normal here, and this might be difficult to identify, but what signs or symptoms should people be looking for in themselves, in their friends at this time?
Great question. I think, I'm interested in hearing really the folks that are clinically involved in this, but I would say that, one of the things just from a person that is a lay person, right, is starting to think about the things that you used to really enjoy. And some of those are in effect sort of being taken away from folks at this time. And if we're not replacing those, then suddenly there may be things that we're doing in place of that. And so I would say start to look at behaviors and things that you used to really enjoy, and how are you trading those out? Are you opting to trade those out for healthy things, or are you opting to potentially trade those out for things such as substances? And so I think just really monitoring your own behavior, that's one of these things that right now, we want folks to really get used to feeling their own emotions and knowing that it's okay to not feel okay right now. And so my tip would be really start to get to know your own emotions and your own baseline and the things that you enjoy, and start to monitor where you're channeling your energy now.
Okay, thank you for that. And Keri, I want you to provide a little bit more of a clinical background here, because I know you have studied the major events like COVID-19 and how they have an impact on mental health. You've looked at the SARS outbreak, even the 9/11 bombings in our country. And I know, Keri, you said recently as many as 2 to 3 million people in our state could be experiencing symptoms over the next 6 months. I want you to break that down. I know you have a graph that can help explain some of these things to us here when it comes to emotional highs and lows. Can you break that down for us, please?
Sure, absolutely. So in studying a lot of different types of disasters, there are a lot of known trends about how people respond to those kinds of things. The graph that you're looking at there shows pieces in time about how people are typically going to respond. So usually within the first 1 to 3 months after the impact of a disaster, you're going to see symptoms of acute stress, maybe more panic, difficulty sleeping, stomach aches, headaches, that sort of thing. And then it's going to transition in the next about 3 to 6 months post-impact. So for Washington, that's mid-March is sort of that timeline starting for us. You're going to see behaviors related to sort of acting out or acting in. So what Dr. Waterland was mentioning about monitoring your own behavior is very essential, because what's normal for you is not what's normal for other people. So paying attention to when you are making choices that are sort of outside of your normal range is a really important part of the process. Moving into about 6 to 9 months away from the impact phase of the disaster, we would be heading into something called the disillusionment phase, which is typical regardless of the type of disaster. So COVID-19 is considered a natural disaster, and that chart refers to basically overlaying mental health symptoms on top of that timeline. So the disillusionment phase is typically the hardest time for people. And for Washington, we're looking at experiencing that sometime in the fall. Now, a lot of that is dependent also on whether or not there's going to be a second wave of illness and whether or not there are additional social or economic disruptions, because all of those things in layers will contribute to people's experiences of symptoms during that time.
Right, right. So much ahead there. Thank you for that breakdown. Brad, let me go to you next. We've been talking about this topic during National Mental Health Month. That's what May is here. And I know NAMI is reaching out with its Connected Together campaign, this whole concept of it's okay to not feel okay, as Keri mentioned there. People undergoing mental health issues felt isolated, I think, long before COVID came around. And it seems like in this time of physical distancing, reaching out really is more important than ever.
Yeah, absolutely. One of the things that we're seeing statewide and really nationwide is a pretty stark increase in people reporting feelings of depression and anxiety, even above and beyond what we were seeing previously. And a lot of that does have to do with isolation. And so, I think one thing that I would really emphasize and encourage people to do is to make sure that on top of looking out for your own mental health, that you look out for the mental well-being of your loved ones in the community, your family and friends. Make sure you're doing fairly continual outreach to check on folks, and that if it seems like people are having some trouble coping with the COVID-19 stress and everything around that isolation, encourage them to seek resources, and there are resources for family members and friends as well. Some of them are provided by NAMI. So I would just encourage folks to utilize the services that are available. And a lot of services have gone online, so you can still remain quarantined and not put your health at risk, but still access some of the levels of care that you were able to access previously.
Yeah, and Brad, let's go down that path. I'll just stick with you here because first you have to overcome the stigma of actually looking for behavioral mental health to reach out and get support. But the next step really is making a connection with a provider that can help in some way. Telemedicine, as you mentioned there, really the order of the day for so many different physical issues, mental issues during the COVID crisis. But I know some people might not be familiar with that, or maybe they don't even have good broadband access. I want to talk about some of the challenges people may have in accessing care and how to deal with those, please.
Yeah, you actually hit the nail on the head there with the issue of broadband access. The governor and the insurance commissioner have both taken significant action to improve access to telemedicine, which is, of course, having meetings with your provider over a computer. And that has worked out very well, and we're hearing is being very well utilized by people during this difficult time. However, there are a lot of folks that live usually in rural areas that don't have access to the level of high-speed internet that is required to have a video chat. So I do want to say that there is currently parity for audio-only telemedicine. So you can, if you have access to a phone line that works, you can talk to a provider. And that's something that I would just really want everyone to know, because I know that there are folks that get discouraged by the lack of video chat capabilities, but they can still absolutely access care.
Thank you for that. Keri, I'll move to you here. I know you're helping coordinate a more than $2 million grant to our state from the Substance Abuse and Mental Health Services Administration, a federal agency under the U.S. Department of Health and Human Services. I know this money is for what's called not a hotline, but a warm line, which I thought was very interesting here for our state, helping people in crisis, giving a boost to our healthcare system too. Can you talk about this grant, what this warm line is all about, please?
Sure, absolutely. I can give some updates too on where we're at right now with the state, and there's a different phase to it as well. So what this line does is it creates essentially a warm line. Thank you. And it's going to be called a program called Washington Listens.
Yeah.
And it's really focused on helping people affected by the stress of the COVID-19 pandemic. And part of what we're really hoping to do with this is twofold. One is to really support folks through the warm line, and I'll talk a little bit about that. But the other is to help to triage folks away from crisis lines and really get appropriate calls to where they need to go.
Right.
And to further kind of support the fact that right now it's okay to feel whatever you're feeling. We don't need to stigmatize and we don't need to pathologize. Some of these are really simply related to the additional stress and this pandemic. And so we want to help to triage the phone calls over to this warm Washington Listens line, as opposed to those more crisis involved situations. And so
Got it.
we're really excited about this because it will give us an outlet to kind of have people just talk about the current stressors and give referrals based on that.
Right.
It helps to fund that line, as well as 120 counselors and team leaders and regional partners. So we've got regional partners throughout the state who will be partnering with us on this. Crisis Connections is located in King County, but
Right.
what they'll really be doing is acting as a central hub to operationalize the support line. And they'll be using a Health Bridge platform so that the entire state can benefit from this.
And it's going to be coming online here in just a matter of a couple of weeks, it sounds like.
It should be up in about 2 weeks, and we are also applying for the second phase. We just finished that application today, and that will extend this out for another 9 months.
Wow, great news. Thank you for that. Kira, I want to head to you here. You've talked about the idea of people building up resiliency when it comes to behavioral and mental health. It certainly sounds great in a time of crisis to try to pull yourself up out of this, but can you try to explain what that is, how people do that? What is that?
Absolutely. So the good news is that the most common human response in the long run to any kind of crisis or disaster is a sense of resilience. We have worked on defining resilience as basically having three components. The first one is adaptability and flexibility. So that is where you kind of have to roll with things. When your life changes, when you're not going out, when there's isolation, and when there's different kinds of restrictions, you need to be creative about how you are reaching out to folks and what you're doing on a day-to-day basis, and really kind of paying attention to that and recognizing the tendency to want to stick with things the old way, even though that's not possible anymore. So flexibility and adaptability is really an important feature of resilience. The next one is connection, and that is any connection. It can be with a pet, it can be with a family member, friends, it can be a spiritual connection, any social groups. Again, it requires creativity to be doing that these days with virtual platforms and whatnot, but that's really an important feature. So trying to enhance and look for ways to connect with other people. The third thing is purpose. That means what gets you out of bed in the morning. And for a lot of folks, the sense of purpose has shifted quite a bit in the last few months. So purpose doesn't have to be a big thing. It doesn't have to be finishing a degree. It can be as simple as what you're going to do today, or even this morning, or working with one of your kids in a homeschool kind of a setting, or taking the dog for a walk. Purpose can be small. It can be large scale. It's dependent on the person. So adaptability and flexibility, connection with others, and having a sense of purpose. And then I kind of cherry on top of resilience. So having a sense of hope for the future and that things they're gonna get better in general.
Certainly a big piece of this. Thank you very much for that. Keri, I'll head back to you. I want to expand on this idea of trying to figure out new ways to find solutions here in terms of being resilient. I know the state has to kind of go through this too. The state has received an emergency behavioral health treatment grant, about $2 million to expand some services. The state really trying to reach out to people who might be uninsured or underinsured. Can you talk about this, please, Keri?
Sure, absolutely. So yeah, we did. We were the recipient of another federal grant during this time, and are really thankful that we were able to, to really get this off the ground. It does provide about $2 million of emergency funding for behavioral health treatment, focused on folks who are not adequately insured to meet the needs that they have identified. So that's one of those things. And that can be either through being underinsured or just not having access to health insurance at all. That will be specifically for increasing access to substance use disorder treatment and mental health treatment in the community. And then there are two other pieces where we're partnering with King County BHO to provide services for folks that are impacted, providers that are impacted by COVID-19, and then to help with some services for folks who are isolated due to COVID-19. So they're kind of a three-piece to that particular grant.
Got it. I know the system we're talking about here for behavioral and mental health in our state really needs to show some resiliency too. So that's a very important part of that moving forward. Brad, I want to jump in with you here and focus, if we could, on this domestic violence angle here. I know NAMI does a lot of work to help out survivors in these cases here, but your research has shown there's no statistical connection between domestic violence and mental illness. And I think this is important. Can you try to tell me what you make of the rise in DV cases in Seattle and other cities that we're seeing right now?
Yeah, so I think that there are a few things happening. One is that there are people that have been living in maybe unhealthy relationships for a while that used to get more space because people were going to work and leaving the home, and there was less time together. And now people are together effectively 24/7, which can worsen already lingering problems. And also, we're hearing that a lot of folks, for example, are experiencing some food insecurity right now. We know that hunger can lead to anger, and domestic violence is a product of anger. But I do want to say that you're right that there's not a statistical correlation between having serious mental illness and committing domestic violence. The correlation is that those living with serious mental illness are actually more likely to be the victims of violence. So I think it's really important that we focus on how to get victims out of unhealthy or even dangerous situations, which is why if you go to NAMI Washington's website, we have a list of COVID-19 resources, and a couple of those deal with how to get help if you or someone you know is experiencing domestic violence during the quarantine.
Thank you. We're going to talk about some of those resources later in the show, too. Dr. Mauseth, an important twist here. We've seen a number of protests in our state and nationwide against some of these COVID-related restrictions that we're going through right now, that we're all going through. When you see people getting aggressive and angry about that, what does that say to you from a psychological perspective? And also, how do you de-escalate that if you're caught up in an argument about COVID restrictions?
Yeah, that's a great question. So there's a lot of uncertainty right now. There's a lot of anxiety about what's going to happen or what's not going to happen. There's a lot of concern about restriction and what that does to people's livelihoods, people being told what they can and can't do. And one of the pretty common manifestations of that is a sense of anger or fear, or both. And it's not atypical. It's actually part of the disaster cycle in terms of how people tend to respond to these kinds of things. The difficulty with COVID-19 is that it's a long, drawn-out process. It's not like an earthquake where infrastructure was immediately impacted and you can't turn on your lights, for example. Right. So because of the unique nature of this, it results in a unique sense of loss of control that we haven't seen with other types of disasters in the United States. So with a sense of a lack of control comes a distinct need for people to try and garner that control however they can. And that can be protesting, that can be following the rules, that can be just doing whatever they can do either in their home or outside of their home to try and maintain and develop a sense of control, because we all need that, especially when there is so much uncertainty. So that's part of what's driving a lot of the sort of social discord that we're seeing and dealing with right now. And it's a normal thing, too.
Yeah. I know so much ahead with that. Kira, thank you for breaking that down. We need to start wrapping up the show. And Keri, I want to start with you here. I think it's so clear from what we've talked about today that mental and behavioral health problems linked to COVID-19 will be around for many, many more months to come, if not longer. What final message do you have for people who are going through some of these issues right now, mental health issues related to the pandemic, and what the state might be doing to help, please?
Sure, absolutely. I think the biggest thing is we're kind of opening up the lines to talk and just acknowledge that behavioral health treatment is treatment. It is medical treatment, and it should be treated as such. And this is an opportunity for us to really acknowledge whole person health and start to really break down stigma around behavioral health services. Okay, so great. I would say ask for help and speak up and know that, just like both of the other panelists have said, this is normal to feel emotions, and talking about them is really helpful.
Absolutely. Thank you for that. Brad, if I could, your final thoughts on what we're going to be looking forward to over the next several months here from a mental health perspective, and what NAMI is doing to help with that. I know you have some support groups that are online right now.
Yeah, we do. If you go to our organization's website, you'll see that we have support groups online throughout the state. So you can participate in a virtual support group with people in your local area. But I just really want to reiterate what you and the other panelists have said, which is that it's okay if you don't feel okay, and that you can always reach out for help. And if you contact NAMI, we will do our best to connect you with the appropriate types of support to help you get through this difficult time.
Thank you for that. Kira, I know you mentioned this earlier, even as COVID cases are starting to decrease a little bit in our state. The science says as we relax some of these physical distancing restrictions, we'll likely see some of these cases go up again. I guess your final thoughts about the need for resiliency now and in the future as we go through what could be a very long-lasting crisis.
Yeah, I think it gives us an opportunity over the summer months to kind of really be opening the conversation about behavioral health concerns and sort of bolstering ourselves up, looking at ourselves, working on our own sense of resilience, and then to the extent that we have the bandwidth for it, basically to reach out and help friends, help neighbors, help community. There's something really interesting with resilience about when people get involved in helping others, it buoys their own sense of efficacy and their own sense of control and resilience generally. So if you're able to, and you can reach out and support other people, that actually will pay off for you as well. And there's lots of good research about that too.
Okay. Thank you all very, very much for your help. And to everybody watching here, there are a number of different resources available from NAMI, from the State Department of Health, and links to crisis connection helplines that you can call or text as well. You can learn more at seattle.gov. Take care of yourself and stay healthy. I'm Brian Callanan. We'll see you next time on City Inside Out.